the back is in fact taken both with the superior extremity as well as with the region of head and neck. Since we are doing superior extremity, we have to mainly confine with the more superficial structures of the back. But before every region, we should have some idea of the surface anatomy of this region. So I invite your attention to this diagram of the surface anatomy of the back. Here you can see a diagram of landmarks, bony marks have been pointed out. First on top, look at the left side. There is a pointer to a prominence that can be felt on the back of your head in the midline. The name of the prominence is external occipital protuberance. Now, in the general anatomy classes with regard to the osteology, we have been told about elevations, depressions, lines and other features that are found on the bone. So protuberance or tubercle is any localized raised bony area. So that is as far as the word protuberance is concerned. Then occipital. Occipital in fact is the name of the bone that forms the back of the skull. The bone that forms the back of the skull is called the occipital bone, and since there is this elevation is present on that bone, it is called occipital protuberance. But then why external? It is because even on the internal aspect of this bone, there is a raised area. So that is also a protuberance. That is also from occipital bone. To distinguish that, the name of this protuberance is external occipital protuberance. So that is one landmark that you can see on the back. How you can feel, just put your finger on the back and you can start from a furrow that is found in the midline, that is called a nuchael furrow. Furrow means any groove, and nuchael pertains to neck. So a groove that you find in the midline of the back of the neck is called nuchael furrow. N-U-C-H-A-L is the nuchael and furrow is U-R-R-O-W, furrow, nuchael furrow. Now in the furrow that you find in the midline of the back of the neck, you can feel the spines of cervical vertebra. But if you take your finger up and as your finger reaches the back of the skull, you can note a midline protuberance or raised bony area, and that is the name of the external occipital protuberance. So that is one landmark that has been pointed. Next one I will take to the other side where there is the arrow pointing to a projection. Now any localized bony projection from the bone is called a process. Here it is mastoid process. Mastoid means literally anything similar to nipple or nipple-like. So a nipple-like bony process that is felt immediately behind the ear. So that is the mastoid process. Now these two landmarks are important. Why? Because in fact there is a bony line on the occipital bone that extends in the form of an arch from the external occipital protuberance and goes towards the mastoid process. That line is called a nuchael line. So I have made a nuchael line. Now this line is also present on the external aspect of the occipital bone. But in fact there is a similar line further lower down on the same bone. So to distinguish the two lines from each other, the upper one is called superior nuchael line and the lower one is called inferior nuchael line. This line that I have marked over here is not simply nuchal line, but it is actually superior nuchal line. So I will just write over here superior, SUP in short, superior nuchal, NUCHAL, nuchal and line. That is superior nuchal line. Now, then we come down in that same nuchal furrow to feel the spines of the cervical vertebra. You know, they are saving cervical spines which make up the vertebrae of the neck region. The first cervical vertebra does not have any spinous process. So the highest spine that you feel in the nuchal furrow will be the spine of the second cervical vertebra. And then you will have, so here you can see there is an arrow pointing to the spine of C2. C stands for cervical and 2 for second. C2 vertebra. In the same furrow you can go on down feeling other spine. They have not been shown over here. What has been shown is the spine of the saving cervical vertebra. Not that the others are not there. They are there. But they are less prominent. They are less prominent also because of another reason that I will just now tell you. But this one, the spine of the saving cervical vertebra is very prominent. And that has been therefore highlighted because of the prominence of the saving cervical spine. The saving cervical vertebra is even called vertebra prominence. It is called vertebra prominence because of a prominent spine that it has. Then what has been marked is T3 spine. Third, thoracic spine. T stands for thoracic and 3 of course is the third. There are 12 thoracic vertebrae. The spines of all the thoracic vertebrae can be felt in the back. The third thoracic spine, why it has been specifically labeled, is because, you see, there is another bone that is seen on the back, and that is the shoulder blade or the scapula. And the shoulder blade has got a raised area which is called the spine of the scapula. Shoulder blade is a rather layman's term. The name of the bone is scapula, and the scapula has got the spine, and the spine where it meets the medial border of the body, the scapula, that point lies opposite the third thoracic spine. So that is why the third thoracic spine has been marked in that diagram. Now this diagram has been taken from your Cunningham's Manual of Dissection, and that's why I want to explain that diagram to you, because it is the main book on which you should mainly depend. Then the spine of the saving cervical vertebra, saving thoracic vertebra has been labeled as T7. T stands for thoracic and saving is of course the number, and spine